Welcome to The Explainer. Today, we're diving into a really detailed proposal to fix some of the deep structural problems in England's National Health Service. If you've ever felt that the system seems broken, this is all about understanding why and exploring one idea for how it might be fixed. Let's start with just one number. In 2023, 7,055 suicides were registered in the United Kingdom. Now, that's not just a statistic, it's a huge recurring loss of life. And the author of the reform proposal we're looking at today, Ricardo Rodriguez, puts it in these stark terms. Think about it. A single plane crash would rightly trigger a massive national investigation. The argument here is that a crisis of this scale demands an equally systemic response. So how do we unpack all this? Here's our game plan. First, we're going to look for what's called the accountability black hole. Then we'll see the real-world impact of that failure. And finally, we'll explore the two-step plan to fix it, some immediate first aid, and then a much bigger long-term constitutional repair. Okay, so what's really at the heart of the problem? You might think it's about not enough money or not enough doctors and nurses, but this proposal argues that the real issue is actually something much deeper, something structural, a fundamental breakdown in who's actually in charge. Now, take a look at this graph. Something pretty dramatic happens to suicide rates in England and Wales right after 2012. They start to climb, and climb sharply. So what happened in 2012? Well, a massive piece of legislation, the Health and Social Care Act, completely reorganized the NHS. And this, right here, is the crucial change. For the first time since the NHS was even founded, that act removed the direct legal duty for the government's health secretary to actually provide healthcare. It basically broke the chain of command, that core line of accountability. See, before 2012, things were pretty simple. If you, the patient, had a problem, the line of responsibility was clear. It went from you to your provider and then straight up to the health secretary, who was directly accountable to Parliament and ultimately to the public. The buck stopped right there. But after 2012, that clear, simple chain got replaced with, well, this. It's a much longer, more complicated web of new organizations. And suddenly, if something went wrong, who was actually responsible? The answer became incredibly murky. So this new, fragmented structure wasn't just confusing on a chart. It created a system with some really dangerous, built-in flaws that have a direct impact on patient safety. And this table really lays it all out. The problems we see on the ground, patients falling through the cracks between services or being discharged too early, are a direct result of gaps in the law. And here's the kicker. No single body within the NHS actually has the power to fix these system-level gaps. Only Parliament can do that.
So let's be absolutely clear. When you hear about a postcode lottery for treatment or a hospital pushing people out too quickly to meet a target, these aren't just isolated mistakes. They are the predictable, logical outcomes of a system that is, by its very design, set up to fail in these specific ways.
And that's why the proposal specifically warns against more surface-level changes. Things like integrating NHS England into the Department of Health, well, without fixing these deep, underlying statutory problems, it's just rearranging the deck chairs on a fundamentally flawed ship. Okay, so faced with this pretty bleak picture, the proposal offers a two-part solution. It starts with an immediate, really practical first step that, crucially, doesn't require a whole new law. So the first step is actually pretty clever. It involves using something called Memoranda of Understanding, or MOUs for short. You can just think of them as formal working agreements between all the different fragmented parts of the NHS. The idea is to beef these up to force everyone to coordinate on patient safety, using the powers they already have. It's a way to get things moving right now. But, and this is a big but, these can't just be friendly handshake deals. For these MOUs to actually work, they need to have real teeth. That means they have to clearly define what triggers a system-level alert, they have to mandate response times, they have to designate who is in charge of fixing it, and they have to make sure Parliament gets the full picture. All right, so the moves are like applying first aid to stop the bleeding. But what about the permanent cure for the underlying injury? Well, that's where the proposal gets really ambitious. The big, long-term solution is a brand new piece of primary legislation with the working title of the NHS Accountability in Patient Rights Act, or NAPRA. And this isn't just another reorganization. It's designed to go back and fix those core constitutional problems created in 2012. And let's be really clear about what constitutional repair means. We are not talking about another managerial shuffle. This is about using the law to rebuild the very foundations of the NHS, to restore those fundamental principles of accountability and universal rights.
So how would it do that? Well, NAPRA would systematically reverse the key failures we've been talking about. It would bring back the health secretary's duty to provide services. It would make patient rights legally enforceable, not just nice suggestions. It would set national standards to finally end the postcode lottery, and it would give regulators the power to fix the whole system, not just inspect one hospital at a time. So what would this all actually mean for you? Well, it would mean an NHS where someone is always accountable, where your rights as a patient are legally protected. And, most importantly, where the system is designed from the ground up to be safe, because the things that cause harm have been fixed in the law itself. You know, when you boil it all down, all of these proposed changes, from the quick fix with MOUs to the huge constitutional repair, they're all driven by one core guiding principle that's so easy to forget, but is so, so important. And that leaves us with this final, crucial question. It gets to the very foundation of the National Health Service. If the NHS truly belongs to the people, shouldn't it be fundamentally, legally, and directly accountable to them?